Furthermore, 50% of all the health facilities in the affected areas were completely destroyed, leaving those remaining functional to cope with an enormous number of casualties. I was there 3 days after the earthquake. I was in Muzaffarabad, and the situation was really tragic. More than 3 million displaced. There was no shelter, almost complete collapse of the health system, with no health care, and in some places not even life-saving interventions. Many health professionals lost their lives or were injured and unable to assume their work. Health services outside of the affected areas tried desperately to cover the gaps. But when Pakistan began restructuring the earthquake-affected areas and utilizing the expertise of international consultants, it was decided to move the town of Balakot 20 kilometers from its original location in order to make it safe from seismic activities. But we have other examples, and one of the other examples is Nepal. A small nation with limited resources is also prone to earthquakes. Scientific predictions indicate that a major earthquake would damage 60% of its infrastructure in affected areas and result in tens of thousands of deaths and much more than 100,000 injuries. In anticipation of this possible loss of life and infrastructure, an assessment of 14 hospitals in the Kathmandu area was carried out in 2001. 4 of these hospitals were prioritized for a more detailed study. Only one of them was found to have a relatively correct resilience to earthquake. Nonetheless, an earthquake of major significance would leave this hospital unable to function because of possible structural and non-structural damage. Consequently, several hospital risk management measures were designed. Action was taken to keep the hospital functioning during a high-intensity earthquake by providing backup generators with adequate fuel to ensure uninterrupted electrical supply. Response scenarios were developed to handle at least hundreds of casualties. Hospital emergency plans were developed, including procedures in the case of interrupted services. Mock drills and simulation exercises have been conducted on an annual basis since then. Simulations involving civil society organizations and health workers strengthened links between the community in this area and the hospital. And also additional hospital wards were built as separate structures, not as additional floors, and in compliance with earthquake-resistant standards. And further assessment of other facilities, which included 6 blood banks, national public health laboratories, and the Epidemiology and Disease Control Division, were also carried out. It is important to understand that such measures will be beneficial not only in terms of the risks ensuing from earthquakes, but also other hazards, including those of man-made origin. Indeed, a hospital with a comprehensive, well-coordinated and up-to-date emergency management plan can deal with any emergency, including floods, chemical spills, fires, infectious disease outbreaks, and strikes. This biennium, 2008 and 2009, is dedicated to this campaign. However, the World Health Organization will not stop there. The organization has recently established a medium-term program on risk reduction for the years between 2008 and 2013, and the hospital's Safe from Disaster is only one of its main pillars. The World Health Organization, ISDR, and the World Bank and their partners inside and outside the UN system aim to achieve a series of goals through this campaign, some of which are raising awareness of decision makers at the government level as well as within local communities of the importance of having health facilities which are safe from disasters and which will remain functional in their aftermath when they are most needed. Supporting governments to conduct assessments of their health facilities to render them more resilient and better prepared. They also aim at protecting hospitals as social and economic assets for communities, thus saving lives and conserving jobs and structures, and finally improving the planning capacity of the health sector through improved hospital planning. Ladies and gentlemen, the price we pay for the failure of hospitals due to disasters is too high, while the costs of making the hospitals safe from disasters is tiny. Damage to health systems affects every part of society. It's a human tragedy, resulting in huge economic losses and inflicting devastating blows to development goals. Making hospitals and other health facilities safe from disasters is life-saving. It's an economic requirement, and it is also a social, moral, and ethical responsibility. The World Health Organization calls on all governments, civil society, donors, and all members of the international community to support and join the campaign.